Hey there, everybody. We are live. It is day 1 of the free program, 5 days to becoming a postnatal fitness specialist. This is day 1. We are talking about pelvic health today, and specifically 3 things your clients might not know about their pelvic health post-pregnancy. So welcome on if you're live or if you are catching the replay. Just want to first, before we go any further, reference the events in Vegas, the tragic terror attacks that occurred last night. Thinking about all who are affected. I know we had a couple members of this specific community who were there and affected. So our hearts and our thoughts are with you. And a big thank you to the heroes and the first responders who are answering those calls. So today we're going to be talking about pelvic health post-pregnancy. Got my pelvis here. We're going to break that out in just a minute. Actually, it is kind of breaking. I'm going to need some work done on this pelvis soon. If you are new here, my name is Jessie Mundell. I am a prenatal postnatal fitness specialist. I coach pregnant people and moms in strength training exercise. So my moms are all over the world, Canada, US, UK, Australia. We have people kind of everywhere. So definitely been talking a lot about pelvic health over the last 10 years that I've been coaching moms and learning more and more all the time. When I first started coaching moms, what I knew about pelvic health was very little. I made an Instagram post today mentioning one topic we're going to be speaking about in a few minutes, and that is about Kegels and prescribing high rates of Kegels to people in pregnancy and specifically postpartum, thinking that that is the way to do it. That's how you heal your pelvic floor postpartum. That's how you get a strong pelvic floor. That's what I used to tell people. That's what I used to tell people 10 years ago when I started coaching moms. That's what their doctors were telling them. That's what I was reading on the internet. So I can only imagine how many pelvic floor issues I contributed to from that advice. So we've come a long way since then, but I really want to make sure that you do not make the same mistakes. And if you are interested in working with moms in fitness, that you go into it with strong knowledge and you don't have to make these missteps along the way that I did. Awesome. I can see a bunch of you chiming in, which is so fun. Say hi. If you are here and listening on, if you have any questions as we go through, definitely let me know. It's weird enough that I'm just talking into my phone right now, so I love to see your comments coming through. I can see my husband on. Okay, so let's get into it. Awesome. Hey, Jocelyn. Hi, Patty. Excellent. So here is one of the first things that I think is so key that people often do not realize or know about their pelvic health postpartum. They have little to no education on pelvic floor dysfunction. If I say PFD, I'm talking about pelvic floor dysfunction. What is pelvic floor dysfunction? What does that even mean for people? We need them to understand that it can mean a range of symptoms. Often with pelvic floor dysfunction, we might think incontinence. We might think leaking. It might not just be incontinence, and especially leaking of urine specifically. That's one thing. But there can be a lot of other symptoms that might be coming up for people. So let them know that incontinence can take on many different forms. It can be urinary incontinence. It can be fecal. In terms of urinary incontinence, what we are probably often going to see with people is stress incontinence, urge incontinence, or a mix of those. So people might be leaking during exercise. They might be leaking when they're lifting the kiddo up from the floor. They might sneeze, cough, laugh, and notice they're leaking. Or they might just feel like they need to go to the bathroom a lot throughout the day. Or when they get that urge to go to the bathroom, they need to go immediately, or they feel like they won't make it. A big one that I hear from my clients sometimes, especially in that early to mid postpartum period, is maybe they're just feeling like they have to go to the bathroom often. They're getting that urge that they need to go to the bathroom often. And then we can have a mix of that. So it's not that people will have one type of incontinence and not the other. They could be experiencing multiple types of incontinence. Educate your clients on pelvic organ prolapse. This is so key. We're going to talk about statistics in a couple of minutes, but pelvic organ prolapse really is something that people get very little to no post or prenatal education on. So while they're pregnant, they probably have not been talked with about prolapse. Postpartum, at that 6-week checkup, they're not talked to about prolapse. So pelvic organ prolapse is when I should have not taken my organs out of the pelvis right now. But we have the bladder, uterus, rectum inside this pelvic bowl. And when we get pelvic organ prolapse, it simply means that those pelvic organs are starting to slump downwards or descend in the pelvis. So they're basically not in their position that might be most optimal for that pelvic floor or pelvic organ function. Talk to our clients about pelvic organ prolapse. Absolutely 100% of the time we need to be educating on prolapse, because that is going to be something that is affecting probably a good chunk of your moms, okay? What else? Pelvic pain. This is another way that pelvic floor dysfunction can show up. SI joint pain in the back of the pelvis, pain in the front of the pelvis, just general discomfort or pain anywhere in the pelvis, or even it can show up in the low back, all right? So biggies to be talking about with your clients that they probably have not been educated on: incontinence, pelvic organ prolapse, and pelvic pain. Excellent. Love to see you all jumping on in your comments come up. Beautiful. Yeah. I just lost the name of that person, but someone said, this is so good. I had 3 babies. No doctor, nurse, or midwife ever mentioned any of this stuff. Yes. It really often is not, and that's why I think our role as fitness or health professionals who are working with postnatal populations, we just have such an incredible opportunity and also responsibility to be having these conversations. Elizabeth asks, how do you approach the conversation of PFD with current clients? Love that. So I would simply start with, again, addressing those 3 things: incontinence, pelvic organ prolapse, pelvic pain, and then just start asking lots of questions. In the Postnatal Fitness Specialist Academy, which is launching next week, for registration again, I have a postnatal fitness client consultation form that has pages and pages of questions that I would ask with my clients. And it really can just be as simple as, do you notice you're leaking urine ever? Do you leak when you laugh? Do you leak when you exercise? Do you feel like you have to go to the bathroom a lot of times throughout the day? Is this normal for you, or has this changed since you've been having, since you've had your baby? These are just basics that we can start with. But again, tons of questions we can be asking. That's what I think is most useful in starting the conversation about pelvic floor dysfunction, is asking questions. Awesome. Hey, Eve. Hey, Laura. Yeah, so good. Okay, second thing I want to touch on, that is the prevalence of pelvic floor dysfunction. So while we might not even know, our clients might not even know that pelvic floor dysfunction is a thing, they might not even know that their symptoms are considered to be pelvic floor dysfunction, they certainly are probably not aware of how common these symptoms are. So incontinence alone, 1 in 4 to as high as 1 in 2 people likely are going to be experiencing some degree of incontinence post-pregnancy. Very high. Those are very high numbers. And again, I like to communicate these statistics with people not to scare them. One of my mantras is always sharing, not scaring. But I think that it is helpful for people to have this information and advice, because then it just normalizes their experience. And then we can start talking about it more and then get them treatment and help them. We don't want to create more stigma around these pelvic floor dysfunction issues. We need to talk about it far more often and more openly. So this is why I think the statistics are important for clients to know. For pelvic organ prolapse, 50% of people who have had a baby are likely going to experience some degree of pelvic organ prolapse. Important to know that there are different grades of pelvic organ prolapse, ranging in severity. A lot of people who are experiencing pelvic organ prolapse that you are working with are going to be on those lesser grades of pelvic organ prolapse. Not as severe, but again, important to know that they are going to be experiencing some degree of prolapse in 50% of your postnatal fitness clients. That's major, right? Last one, pelvic pain up to 33% of people. I think the ages, I should have wrote that down. The ages are 18 to 55. 33% of people will experience pelvic pain in their lifetime. These statistics are all from the lecture in week 1 of the Postnatal Fitness Specialist Academy. So it's just incredible that we often don't even know that pelvic floor dysfunction is a thing, and then we don't know how common it is. If you're working with postnatal fitness populations, you absolutely need to have this information, because we need to then be able to go forward, design a fitness program, and be able to talk lifestyle concerns, situations with our clients to help them. Because we know that so many moms are working with these symptoms and these issues. So it's imperative that we are able to guide them and lead them and help them. All sound good? Okay, last thing I want to talk about with you today, Kegels. Like I was saying, when I first started coaching moms 10 years ago, blanket prescription was to be doing, say, 3 sets of 50 Kegels every day, multiple times per day. This is what I thought was good for the pelvic floor. This is still happening. My clients, again, all around the world are coming back post-pregnancy, check up with their doctor, their OB. Some of them are still being told, do your Kegels. They are leaking. They're telling their doctor maybe they're experiencing incontinence. Doctor is saying, do your Kegels. For a lot of people, this is not going to be helpful advice whatsoever. I'm just going to give you one example of why. So here again is our pelvis. Underneath, you can see all these red bits. This is the pelvic floor. So it's the bottom of the pelvis, last part in the body, in the trunk of the body that holds stuff in. Very important. When we are doing Kegels, what tends to happen is that people are just contracting up, up, up. There is no relaxation or let down of that muscular contraction. So if we are only having this lifting, contraction, this building of tension, that is going to cause issues in the pelvic floor. So if you just think about it in terms of bicep curls, if we are only doing bicep curls from this position, if we are never fully extending and then gaining tension or power or strength through that whole rep, that is going to inhibit the function of that muscle. The pelvic floor is a group of muscles and connective tissues, and it needs to be trained as such. The pelvic floor does not just act in isolation either with itself or just with the pelvic floor muscles. There's so much other stuff that it needs to talk with and interact with. The whole core, the whole trunk, the whole body. This is why Kegels can be an issue, especially if there is no consideration of alignment or breathing, or how we then put that contraction and relaxation piece of the puzzle into movement as well. So much that we can talk about just with Kegels alone, but this is why I would strongly caution us against telling people to do Kegels and lots of them without fully talking through what that Kegel looks like, what that sensation feels like, and with having them get treatment from a pelvic health physical therapist. Okay? So 3 things your clients might not know about their pelvic health post-pregnancy: what pelvic floor dysfunction is, how common the prevalence of those symptoms can be, and then also they might just not know that Kegels and lots of reps of them are probably not the best route for them post-pregnancy. Sound good? Okay, cool. I lost so many of your comments. I'm just going to grab my computer here so I can find them. Cool. Let me know if you have any more questions. I want to keep this short and sweet and just really give you some actionable stuff to use right now. So we'll probably cap it there for today unless I see more comments coming through. Was that helpful? Makes sense? Everything makes sense, or do you need more guidance on it? Cool. Looks like we're all good. Okay, so this is what I think is super important to be starting with today because it's going to set the tone for everything you do with postnatal fitness clients. We need to be having these conversations right off the hop. In your consultation form, we're asking tons of questions about these pelvic floor dysfunction symptoms that might be coming up so we can start the conversation immediately. Mia, I think you asked what is your best resource for exercises other than Kegels for the pelvic floor? So with my clients, I always, if possible, send them to pelvic health physio. I think that is so key because we need to know how the pelvic floor is actually functioning before we then move on to treatment or exercises. My clients start with the Core Plus Floor Restore program, which is available on my website or in the Postnatal Fitness Specialist Academy. You have access to that program. And then also just great stuff from Diane Lee, Julie Wiebe, Anthony Lowe, Brianna Battles, so many incredible people who are doing great work on this topic as well. Lots of articles on my site, jessymundell.com, and also some on girlsgonestrong.com as well that I've written for there too. Someone asks, are Kegels good during pregnancy? They might be good during pregnancy. Again, it really does depend on the individual body and how someone's pelvic floor is functioning. Do they need to be doing Kegels? Maybe. Do they need to be doing 150 reps per day? Probably not. So there's gray area in this conversation. Benjamin, how long after giving birth are we considering someone postnatal? I love that question so much. I still talk about myself as being postnatal, postpartum, and my kiddo is over 2. So I think though that the first year, I consider that to be early postpartum. The first 6 months, very early postpartum. Does that help? And also interesting to note, studies show that up to 50% of people can't do a correct Kegel with written instruction alone. Yeah, absolutely. In the guidebook that I sent out this morning, I was also talking about how people often cannot get that action happening in the pelvic floor. Often they're bearing down on the pelvic floor, or they're squeezing their glutes or their abdominals super tight. So doing a good optimal pelvic floor contraction can be really difficult for people to do. All right. Anything else on pelvic floor dysfunction? Or did we cover it today? Tomorrow, we are going to be back here, same time, same place. Tomorrow, we're going to be talking about finding the sweet spot for appropriate postpartum exercise intensity. Something that I like to talk about a lot. Excited about this one. If you have any questions, do let me know in the comments below. And if you are just signing up and you didn't get the guidebook still that I sent out this morning that has the notes and the details all about all 5 topics that we're going to be chatting about this week, you can still sign up. I just put that guidebook in the first email you're going to receive if you're just signing up today. So you can still get access to it. I will put that link below. I think that's everything. I will be back tomorrow, 3 p.m. Eastern, right here, talking about postpartum exercise intensity. Thank you, friends, so much for joining in today. I'll get to your questions if I have missed them here in the comments below. See you tomorrow.